What is going on, Busy Bariatrics? Today we need to talk about something that almost nobody in the bariatric space explains well enough. Some of you are out here blaming yourself for failing, while your nervous system is basically running a four-alarm fire 24/7. You're exhausted, you're overwhelmed, you're stressed, you're sleeping 4 to 5 hours a night, your hormones are shifting, your relationships changed, your body changed, your routines changed. Heck, maybe your entire identity has been changing. And then you're wondering why fat loss suddenly feels harder than it did 6 months ago. That's because bariatric surgery does change your stomach, but it does not magically remove stress, trauma, cortisol, poor sleep, emotional eating patterns, relationship issues, burnout, or the fact that half of you are trying to survive on caffeine, vibes, and that 4 hours of sleep. And I need you to hear this next part carefully. Stress itself isn't going to magically stop fat loss after bariatric surgery, but stress absolutely changes behavior. That part's really going to matter because when you're stressed and when your stress goes up, your recovery starts to drop, your sleep quality drops, your hunger cues are going to get weird because ghrelin and leptin are coming out of range. Your cravings are going to increase. Your patience disappears. Your emotional regulation tanks. Your energy to prep food disappears. Your workouts become inconsistent. Your step count drops. And your decision making gets sloppier. That's really very common. But the thing that people then say is, my metabolism is broken or my sleeve didn't work. Meanwhile, they've slept 19 total hours this week, and they're white knuckling their way through a life like a hostage negotiator. And quite frankly, it doesn't work. Now, when you add bariatric surgery on top of all this, your body's also adapting to major weight loss, a severely lower calorie count than it's used to, hormone changes, possible nutrient deficiencies, loose skin, body image, identity shifts, attention from other people, relationship changes, and sometimes grief. Yeah, there is a level of grief after weight loss surgery because some people lose weight and suddenly realize their relationships were struggling long before surgery. Their coping mechanisms disappear, or because their coping mechanism was food, they no longer can go to it. A lot of their friendships might have changed because you now are not doing the same activities. Your family may start to get weird about boundaries, and people might start treating you differently. You may even realize that you don't even recognize the person in the pictures anymore, and nobody really talks about that part. If you're a female and you add in the fact that the average bariatric age is anywhere from about 35 to 55, you have to have the considerations of perimenopause and menopause into the conversation. And that's really where biology does play another role because during perimenopause and menopause, your estrogen's going to shift, your sleep quality is often going to worsen, stress sensitivity increases while recovery changes. Add on to the fact that muscle retention does become a little bit harder and fat distribution can change, as well as your hunger and fullness signaling can become inconsistent. That does not mean you can't get great results after bariatric surgery or during menopause or perimenopause. But it does mean that the old eat less and do more cardio setup really becomes harder to do and probably less effective. This is why experts that I know, love, and trust, as well as how our coaches coach it, is by saying the same things with the importance of lifting weights, building muscle, prioritizing your protein, walking consistently, and managing your stress. And then, most importantly, at the end of all of that, going to bed and sleeping like it's part of your program because it actually is. When you're sleep deprived, and we've gone over this in multiple videos, you're knocking off your hunger hormones, your recovery, your insulin sensitivity, decision making. You get the whole idea. And your ability to say, like, I don't need to regulate food, and that becomes an issue because now your emotional regulation is off. Emotional regulation is going to be one of the most underrated skills after bariatric surgery because moving forward, every meal can't really become your comfort, your reward, your celebration, your stress relief, or your dopamine, or even your entertainment. Food at some point just has to become food, and I know that can be devastating, but at the same time, you need to understand that your body does keep the score, and your habits are going to reflect your nervous system. So if your entire life feels chaotic, your behaviors usually follow that chaos. And that's why we align so much into Busy Bariatrics. If you're sleep deprived, you're not going to make the right choices, which is why we focus so hard on dialing in a clear sleep routine and getting you to bed. Your calendar has to reflect so that you don't keep overwhelming yourself day after day by putting your commitments in place. Once that aligned, your stress level is going to come down. Once we start to then identify like that it's not overwhelm, but so much as like here are individual stressors, we start to work on them one by one so that your stress management level increases while your actual stress level decreases. The more that we keep building that environment, we have then kind of get to identify where we need to continue to do the work. And for a lot of us, that comes down to relationships. But everyone wants to start relationships first when they haven't really cleaned up the house or the order of things, which is why this is something we work on so often. So what should you do if you're looking at this? Number one, protect your sleep like your results depend on it, because they do. Set a clear bedtime, reduce your nighttime scrolling, cut the bedtime procrastination, and make sure that you are getting off your phone. I highly recommend taking your phone, putting it in another room other than your bedroom so that you can go right to bed. Number two, walk daily. Walking regulates stress better than most people realize, and movement for a lot of us is a simple way to emotionally regulate. For me, I call it an emotional lap, which just means that when I am stressed, tired, anxious, I take a minute to walk around the block and get something done. Can't go outside? This is why investing in a treadmill or having spaces nearby, like a Target or a Walmart, where you can walk and get your steps out until you reset yourself, can be a very big deal. Number three, lift your weights consistently. You don't want to do random punishment workouts, and you don't want to do some sort of survival cardio, but having clear set habits, patterns, behaviors around the gym and lifts that you know will build strength and increase endurance will play a big role in keeping you consistent even when life isn't. Number four, learning emotional regulation skills outside of food. This one's going to be a huge lift. For a lot of us, it looks like journaling and actually getting into the reason as to why you are feeling the emotions you are and how to regulate them. It can be something as simple as, like, in the moment, taking some time to breathe and get your heart rate down. For religious people, this can be prayer, and others, it can be therapy. But finding ways that actually address your feelings is going to help regulate your binge eating more than anything else. Number five, audit your relationships and environment. I think a lot of the times a big mistake that I see is people literally trying to keep the same foods in their house early on, when in reality, they need to reset the relationship and the behavior. If you're constantly going through the fast food menu, like, you're kind of putting yourself in a setup that's kind of tricky. If you were an alcoholic, you wouldn't necessarily say, hey, the way we're going to heal our relationship with alcohol is I want you to sit in a bar every night. And I knew food's a little different than that, because you have to eat every day in order to exist, but you also don't have to surround yourself with Reese cups or double whoppers, two of my personal favorites that had to take a pause and go away in order for me to fix everything. The more that you start fixing your environment, the more you're going to realize that it's ready and set to go. Your job right now after bariatric surgery is to build systems that support the future version of you. That process is going to be slow. It's going to be worked around building consistency, and you're going to have to be patient in the process. Many clients want this done in the first 30 days, when in reality, it's more of a 6 to 9 month commitment, and it really does depend on the pace that you're willing to work on. The other part we see is clients that really want to work on building their relationship means, like, we don't add more, but we necessarily take less and do it better. It's not the idea that more is better. It's the idea that better is better. So something that we really do is we audit what are our habits, patterns, behaviors at this point, and we eliminate the ones that make us look busy but don't actually get the results. So if you're sitting there thinking, like, how can we actually put all this together? Or if this episode punched you directly in the gut and you're thinking, man, I need some work to do, that's totally fine. Go ahead and message me after watching this video, or tag someone or share this link with someone who could benefit from learning that running on stress fumes and caffeine isn't working for them. Because at the end of the day, it's not that you're uncoachable or that you're not successful after bariatric surgery. You just haven't worked with a team that understands the habits, patterns, behaviors that need to be built, and the systems in place that are going to keep you running for years after weight loss surgery. As always, keep getting busy.